Nice day. All right, so what's on your mind? President Obama today is going to be busy out there selling that health care reform plan that everybody's been talking about.
Congressman Brian Bilbray joins us live to talk about what's on the agenda and how it could affect us all here at home. Good morning, Congressman.
Good morning, Sandra. Good morning, Dan.
Great to see you. Hey, we are going to get to the health care issue, which is the #1 issue today, domestically anyway. But let's talk about Iran and President Obama on the hot seat for his what some perceive to be a late response of anger or outrage to what's going on there. What is your take on all of that?
My take is that people ought to just lay off the president, as he's got to learn. I mean, he's not the former director of the CIA with a lot of background here, and he's on a steep learning curve. But it just seems like they don't understand. This is a guy who's going to have to learn by doing and quit finding every chance to take a cheap shot at him. I think he will make mistakes, but we just got to help him through it rather than constantly just try to find fault.
Is this the nitpicking of Barack Obama, you think?
Well, I think there's going to be a lot of, let's just say, nitpicking. I think that problem is a lot of people, sold the new president as being the catch-all for everything, and that's a hard sell to deliver with. So he's had such high expectations that there's going to be a lot of people that are going to be frustrated that he doesn't turn out to be as smooth as they thought he was during the debate. But the fact is he's learning. This is no longer campaigning. This is governance, and it's going to be tough, and he's going to make mistakes. And I think people are really unfair not to expect a new guy who's never managed any real structure not to make these little stumbles along the way. And frankly, with Iran, I think he's been right to be very cautious, especially with the fact that he's learning during this deal. So I think he's doing the right thing for him to be doing.
Let's talk about health care today. That is on the agenda, and the president agrees that a major overhaul is needed in America. Of course, the big question is how to pay for it.
Great question. And we're talking, Washington's talking between $1 trillion and $2 trillion for the government to basically guarantee health care for everybody in the country. That's quite a price tag, and I think that any good consumer would say before they'll say, I'll buy it, you first of all like to see what's being sold, which we haven't seen, and then we'd like to know what the price tag is. So I think that this is there's a long way to go to be able to justify this, and I don't think the policy that we saw the last few months that, well, if you don't vote for what we propose, you're against everything, is not going to sell. I think they need to be they've got an obligation to come up with a good product, a product that talks about prevention the way the president, but also does something about prevention, that talks about making sure that research is not strangled. Remember, San Diego is, one of the world capitals for health research that brings us all these miracles. All these things need to be answered. It's not just, well, if you're for it, you'll vote for whatever comes down the line, and if you vote against it, you're just against all reform. I think there's got to be some quality in this product and a price tag that is acceptable.
I think one of the problems is, and we saw John McCain in a committee last week showing some outrage, basically saying, look, this is a huge, massive undertaking, but there is no price tag. We need a price tag on this thing.
Well, the fact is, he is speaking for the people who are going to have to pay this bill. And it may not be the voters of today, but we know our children and grandchildren are going to be taking it out. And I think this attitude of don't worry, we'll figure out somebody else to tax or somebody else to take the money away from. This one's a big one. And remember, Dan, we're not talking about 60 million people in France or 50 million in England. We're talking 350 million. This would be the largest healthcare system in the entire world. And it's one that nobody has ever gone this far. So I think that we really need to be careful and make sure we do it right. I think Romney, in a lot of ways, the governor of Massachusetts, probably had the right way, and that's saying, let's try to see how far states can get this right and maybe learn by trying a whole lot of different programs rather than buying off to one monolithic federal system that may never be able to be changed or stopped or paid for once you get it going.
Yeah. Well, it certainly is one of the bigger challenges facing us here in this country. What are your plans for today, Congressman? What are you up to?
Well, we're actually looking at a lot of stuff. I'm really interested in seeing what comes down and on this climate change issue. Is it something that is actually going to address the challenge of climate, or is it like Washington normally? You got the coal industry getting a cut, the ethanol industry getting a cut. You've got business lining up to try to figure out how to get a cut out of something under the guise that the climate crisis justifies them to be able to reshuffle the cards. So I'm really concerned as a former member of the Air Resources Board in California. I want to make sure Washington does the right thing. We don't want to see another methanol, MTBE, ethanol debacle where people say, well, we meant well, but we just didn't mean to hurt the environment this much.
All right, good deal. Before we let you go, I just wanted to ask you about this Cash-For-Clunkers program. A lot of people are talking about this, and obviously once the president hasn't signed it yet, but once it is, a couple things. Number one, I guess it's sort of ripe for fraud in terms of people trying to just get in on the program, number one. Number two, do you like this program? Do you think it's going to work?
Well, Dan, like I said, as a former air pollution guy, I remember crushing cars in San Diego back in the 90s, but you really have got to make sure that the fraud issue doesn't get ahead of it. I mean, in San Diego, we could see guys bringing cars in from down south of the border and then claiming to get it crushed to be able to make sales and then falsify the sales. It's really one of those things that, again, we got to make sure we get the details and the facts worked out. Just saying you think or you'd like it to work out this way doesn't necessarily work out. We've seen that problems and other strategies like that. But we were able to make it work pretty well in San Diego. But again, we were small enough to manage it and watch it. And when the problems started showing up and we had problems, we were able to address it. Federal government historically has not been able to do that, and I think that's the real challenge. I'd like to see the local air districts and the local administrators given more authority to be able to keep an eye on it rather than thinking Washington is going to be able to keep an eye on it from way out here.
That's a good idea.
Congressman Bilbray, thanks so much for joining us this morning on Good Morning San Diego, and enjoy your Wednesday.
Absolutely, and look forward to coming home this weekend.
All right. Have a safe trip.